This visceral peritoneum in the pelvic region. In the pelvic region. It is forming here two pouches. One pouch is forming between the urinary bladder and the uterus. This pouch is known as vasicouterine pouch. Okay, which pouch? Vasicouterine pouch. And another pouch is forming, which is forming between the uterus and the rectum. This pouch is known as rectouterine pouch, or it is also known as, Douglas pouch. Okay, Douglas pouch. Sorry, pouch. It is also known as Douglas pouch. Okay, so see here, if you draw here the diagram yourself, urinary bladder, uterus, and the rectum. So see here, this is the peritoneum. Now it is forming here the folds like this. Rough diagram. This pouch is known as vasicouterine pouch because it is forming between the urinary bladder and the uterus. And this pouch which is forming between the uterus and the rectum, this pouch is known as Douglas pouch. Which pouch? Douglas pouch. So please remember, whenever the patient is in the standing position, okay, and if there is any fluid accumulation in the peritoneal cavity, that fluid, it is going to enter into this pouch, Douglas pouch. Okay, it is going to enter into which pouch? Douglas pouch. But if the patient is in the lying position, bedridden patient, okay, so in the bedridden patient, the fluid will accumulate in the Morrison pouch. Morrison pouch, which is present here. Okay, Morrison pouch. I will show you another diagram for the Morrison pouch, but just remember here that this pouch, see here, this pouch which is forming between the uterus and your rectum, this pouch is known as Douglas pouch. Okay, so Douglas pouch is which pouch? It is a pouch which is also known as rectouterine pouch, and it is forming between the rectum and the uterus. The second pouch which is forming between the uterus and the urinary bladder, this is known as vasicouterine pouch. Vasicouterine pouch. Okay, so this is your Douglas pouch. And see here, this Douglas pouch here is in close relation with the posterior fornix of vagina. And sometimes if fluid is accumulating here, for example, fluid is accumulating in the Douglas pouch, and I want to remove this fluid, what I will do, I will enter through the vagina, and through the posterior fornix of the vagina, I can remove the fluid from the Douglas pouch. Okay, and this process is known as chordosynthesis process. Okay, it is known as which process? Chordosynthesis process. So through the posterior fornix of the vagina, you can remove the fluid which is accumulating in the Douglas pouch. Okay, maybe it is due to inflammation, due to tumor, or due to any other cause. Fluid will enter into this pouch. Okay, into the Douglas pouch. So when it fluid enters into the Douglas pouch, you have to remove this pouch. You have to remove the fluid, and what you are going to do, you are going to enter to the posterior fornix of the vagina, and now you can remove the fluid or that inflammatory fluid or fluid from that pouch. That process is known as chordosynthesis. That is known as what? Chordosynthesis. It is clear to everyone.